Hi, I'm Dr. Emil Liu here at the ASCO annual meeting in 2015. I'm honored to be here today with Dr. Alok Khorana, who is director of the GI malignancy program at Cleveland Clinic. Today is Saturday, May 30th, and we heard some exciting data earlier today about Pembrolizumab in metastatic colorectal cancer. There were some striking differences in a subset analyses of patients who had microsatellite unstable tumors. Mismatch repair protein mutations have been tested and pretty much worldwide across the board at different stages of colorectal cancer at this point. So to see a difference in Pembro that was that striking, overall response rate was pretty striking. What are your thoughts on this, Dr. Khorana?
So I think it's really exciting. It's probably the hottest GI abstract that you would have thought with all the big phase 3 studies being presented, there would be something more interesting. But this abstract really is very striking. The results are so different between the mismatch repair deficient population and the mismatch repair proficient population. And it's also very sort of encouraging that we do these types of analyses already. You already know your MSI status in most of your patients because you tested them for Lynch syndrome screening. So it's already a biomarker that's widely available. Every hospital knows how to do it. Most hospitals do it mandatory anyways. And so it's a biomarker that's in every hospital right now, so it could be used tomorrow if you needed to. And the results, which also appear in a New England Journal publication simultaneously, typically we want to look for phase 3 studies, but honestly you want a phase 2 study that's so good that you need to do a phase 3 study, and I think this will probably fall under that category.
Yeah, I think it's rare that you come to a session. I mean, we're excited about many abstracts and many advances, but I think this one has already generated a lot of excitement, and it's very timely that the New England Journal article is actually going to be published online. I think probably today, if not early this week. We're going to find out more. There was some mention, I think also online, we saw about whether BRAF mutations are mutually exclusive with microsatellite stability. What are your thoughts on that?
I think there's some data suggesting that, but it's better to do the testing other than guess based on the BRAF status at this point. And again, it's more common to do the MSI testing than to do the BRAF testing because that's not standard practice for most hospitals.
Right.
There's also controversy on whether BRAF is predictive or not predictive in response to EGFR therapy. Our practice is not to typically test for BRAF. I think we test for extended RAS. We have been doing that for over a year, but we're not necessarily excluding BRAF patients at this point.
Yeah, I think with I think the advent can be traced back to 2014 with all RAS testing. You look back and you think of all the patients like KRAS wild type and responded very poorly to EGFR inhibitors. And it's only in hindsight that as 2020 that did you miss that 10 or 15% that had the NRAS testing. In many centers, I think BRAF is done reflex if KRAS is wild type. Is that what happens at Cleveland Clinic?
Yes.
Okay.
And we've been pushing the extended RAS testing for a while now at the Cleveland Clinic. I think actually half of patients that receive anti-EGFR inhibitors are still not getting extended RAS testing. So that's billions of dollars that are being spent on these patients and the toxicity of the skin rash and so on. So I think it's important that we get the message out there.
Right, exactly. Over the last decade, the Crystal and Opus trials and even recent studies in the Journal of Clinical Oncology have really elucidated very clearly that the standard of care is only in wild-type KRAS patients. So this is a great advance today. I think it's pretty exciting.
Very exciting.
Immunotherapy has arrived in colorectal cancer as of today. So look forward to more data, and thanks very much for taking the time to discuss this with us.
Thank you.